Hello, are you a nurse who wants to study medicine? Then this video is for you. So, if you don't know me, I'm Pooja. I am a second year medical student and I've also been a nurse for a few years now. I started working as a nurse in 2019 and I started studying medicine last year in 2025. So, I had been a nurse for more than 6 years by then. And the number one tip that I'm going to share with you today, if you want to do medicine, is do not be stuck. Okay. And I mean it in a sense that do not be stuck in a place. Like working in one place, you've been working there for a few years and it gets very comfortable. You just don't want to leave. But I keep telling everyone who is a nurse who messages me and my friends as well who wants to do medicine, I keep telling them, like, widen your horizons, widen your experience. The more wards you go to, there are different things that you have to learn. So talking about my nursing journey, I started working in an aged care. I was there for about 2 years, pretty long time if you ask me. But then I moved on to hospital setting, and then I started working in a subacute ward. Then I moved on to a surgical ward. That was a steep learning curve. And then after that, I went to ICU where I did my postgrad in ICU as well. And I kind of didn't want to leave ICU. I think it's a fact that if you work in ICU, you don't want to move anywhere else. But one thing I regret not doing is not working in ED. I should have worked in ED. I don't know why I did. So that is something that I regret. But apart from that, I feel like I do have a wide range of experience in terms of nursing jobs and then the things that I got to see. So I'm not scared of seeing like chest strains or, oh my, like that's nothing compared to what you see in ICU, right? And I'm trained in ALS and stuff like that, so that really helps. Another thing is ask the questions, okay? Like befriend your doctors. Like I cannot fathom why I didn't do it while I was back in my old workplace in Tasmania. I had a great team of doctors and some amazing nurses where I worked in ICU in Tasmania, and they were so very friendly. Like, if you ask the doctors to explain things to you, they're usually very friendly and they want to explain it. I don't know, but for me, if I try and explain it to someone else, I understand it better myself. So I think that applies to a lot of people, and a lot of doctors are actually very helpful in that sense. Like they want to explain and you have to show your interest. But I felt like there was so much room for so much more questions and so much more improvement. And that is something that I urge you to do. Okay, widen your experience, widen your horizon, ask the questions. If you find like something interesting, look it up. Don't forget about it, especially if you're wanting to do medicine, because it is gonna pop up sometimes and you regret not doing it. Okay, so I hope this was helpful. And if you have any questions, don't forget to comment. Okay, bye.